What were you thinking about when you got pregnant, that you were not going to work? I'm just curious, because like I've had 3 kids. I worked up until the second they were born.
But am I you? Are you me? Do you know how I feel? Do you know how my body feels?
That's why I'm asking. I'm interested to know what you think. I want to know your mindset. So when you got pregnant, what were you thinking about?
I was thinking about having a kid. I'm confused on where you're going at.
I'm confused too, because you came in here and I did an assessment and I gave you my best medical advice. And you didn't like that.
But I said that I just wanted a note so I could take it easy these next 2 months. I'm 7 months pregnant and I'm in pain. It's not fraud. If it was fraud, the doctor wouldn't be getting me my note right now.
Really?
Yes.
What I read on your chart isn't true.
Okay.
So I
What's
know
on my
it's
chart
fraud.
that's not true?
I read on your chart what isn't true, because I'm the person who saw you and did the exam.
Nurse Karen there berating a patient, acting like she's her child. I think you guys can figure out the dynamic that's going on here. As this woman went into the Philadelphia Pregnancy Center, she posted this video because she started recording as this nurse practitioner was berating her for looking for a doctor's note so she can give to her employer so she can take it easy because she's going through serious discomfort in her pregnancy. And instead, she got this. Now, things got much worse once this patient started recording the nurse's face to show who this was that was berating her, not doing her job, instead talking down to her. Let's watch more.
But how do you know how I feel? How do you know how my body feels inside?
Because I stuck my hand in there and checked your cervix.
Okay, you checked my cervix, but how you know how my bones feel? How you know how my body feels, my legs, my back? How do you know how that feels? How you know how my nausea feels? How you know how my cramps feel? By touching, and you're okay. All right, so this is the nurse practitioner, and look how she's hitting me. Look at it. Check her out. Check it out. Call the police, and they're going to see what you just did. Call the police. She already called the police on me once because I called her a weirdo. Yes, look at you. This lady is crazy. Call the cops again. Call them.
It's okay.
Call them. I got you on video hitting me with that thing in your hand. This is the Philly Pregnancy Center, guys.
Yeah. Okay, Jillian.
She didn't want to give.
Suddenly, the cops need to be called by this nurse who's swinging that device at the patient for showing her face, putting an identity to the person who's berating a patient. That's what we definitely can't have. Let's get the police, because the police are gonna be on my side. You know why she thinks that? I think you guys can figure out why she thinks that. Here's some details of how this all went down, because as it led to this escalating moment, there was things that she was doing beforehand. So Jill, the patient, said she described her pain. Then the employee examining her cut her off and examined her cervix very aggressively. She said it was painful. She said the staffer then refused to give her a note to take to work, as we then just saw. Jill responded by asking to speak to a doctor about the note and was taken to a back office to speak to a doctor on the phone. Then she said the staffer said, "Please don't take her to my office." And Jill responded, "No one wants to go to your office. You're a weirdo for that," which she pointed out she had called her weirdo before that. That's when the employee said she was calling the police the first time. That's according to an account from Jill in one of her videos. Let's actually go to Jill in one of her videos, because she explained more about what happened and led up to this whole thing. Again, it's aggressive nature of her even examining her to then berating her and saying, "It looks like you just don't want to go to work." Where's she getting all these assumptions from? I don't know, but let's watch what Jill had to say.
After I got off the phone with the doctor when I was in the back room, after she came back there, said she was calling the cops, I told her to call them, so on and so forth. After I calmed down, because I had a panic attack back there. I'm like crying because I'm just like, oh my goodness, like this is not what I thought I was coming here for. Like, why am I going through so much? Like, I come out the back office, it's cops in there. So I'm like, oh my goodness, she really called the cops. I spoke to the police, and she told the police the reason she called them is because she felt threatened. And I told the cop, I said, look at me, like I'm going on 8 months pregnant. I'm 7 months pregnant. I'm pretty far along. Do I look like I'm in a position to be attacking somebody? Like, I don't understand what her problem is. And they was like, yeah, she said she felt like you just came in here just to get a note to get a free ride or some crazy stuff like that.
The mistreatment was just off the charts there. She continued on and talked about the aggressive nature of this particular woman who was supposed to be helping her again. Let's go back to this. It's supposed to be helping her. And now you go to get checked out and get your doctor's note because you're in pain and discomfort for your pregnancy. Because we're protecting pregnant women in this country, right? We want nice, new, healthy babies, right? This is the wrong kind, it seems. There's more about this and also the reasons why we have so many folks having complications that honestly are unnecessary. But yeah, a few of your first thoughts on this.
Yeah, I mean, this one's tough for me because I live in Texas, and Texas has one of the highest maternal morbidity rates in the country. And they were supposed to do more research on this, more updated research for 2023, but they've held off on that until after the November election. This November 2022, when we're supposed to be electing a lot of state leaders, including a new governor. They don't want any kind of data that would make the Republicans look bad in this country to come out before the election, because God forbid people decide not to vote for the same Republican leadership that did this to us, that is killing mothers in maternity wards and not giving them the health care that they need. In identity politics, this is a really great example of how identity politics can actually cost lives and how discrimination in the healthcare system is very real, whether or not it's conscious. Our leaders are letting us down. They're picking these cultural wars and then they're stepping out of the ring. They're kind of letting us fight their battles amongst ourselves. And this is a great example of how all of that divisive and racist and classist rhetoric can overstep into people's real lives.
And they just don't care. As a matter of fact, this one particular dialysis place, prenatal diagnosis, was getting complaints over this. And they responded. I was a little surprised by this response. Let's look at that. It said, respect your comment very much. One person was talking to them. Thank you. In this clip, please note that the NP tried to have a conversation with a terribly upset patient. Why was she terribly upset? The NP examined the patient. Into her professional opinion, she thought that medically there is no indication for the patient to be excused completely from work. Right or wrong, this is a different discussion. Which part about it? The way she treated her or her professional opinion that apparently wasn't right? Does she know exactly how this woman's feeling? Because she checked her cervix aggressively, by the way, and now she has all the answers. Let's just trust her and not listen to her patients at all. If someone is, I don't know, rich, famous, has the attorneys behind them and all that, do you think they'd be treating them like this? Or do they have these assumptions about this particular woman? Either way it goes, after the whole fallout continued, the Philly Pregnancy Center did release this statement. He said, we at the Philly Pregnancy Center have taken the recent uproar over the conduct of one of our contract nurse practitioners very seriously. The incident, her response, and the entire matter is under investigation. That's what it is. We've never encountered anything like this. So we're starting a top to bottom analysis of how we work with our patients to make sure we interact with each person in a medically and socially appropriate manner. Yeah, and they have a great staff and they do all that. And they've been doing this and it's diverse. We're helping people because they're now seeing how this is and what it looks like. Instead of saying, hey, this nurse practitioner is not following anything that we're supposed to be doing, doesn't follow our guidelines, the way we treat our patients. This is disturbing and we're gonna get to the bottom of it. As a matter of fact, she's not seeing any patients until we figure this whole thing out because we don't trust her. Based off of her assaulting one of them, we can call it that, and berating them based off of what she believes they don't wanna do. Which part of your professional opinion has to do with what your assumption is about whether or not she wants to work? Let's go to this last point, you guys, because the maternal mortality ratios in selected countries in 2018 or later shows this chart that the US is skyrocketed above others. And even more so, as we know, whenever people are treated like second-class citizens, folks that we assume are second-class citizens get it even worse. So according to the CDC, Black people are 4 times as likely as white folks to die of pregnancy-related causes. They have greater odds of receiving insufficient pain medication, having their concerns ignored by doctors, ding, ding, and experiencing complications such as dangerously high blood pressure at greater rates. These things can be preventable. It happened to Serena Williams in her pregnancy, how they ignored her and she had to literally say, listen, I'm gonna take over and take care of this because I know what my body feels like, and it probably saved her life.
Yeah, I mean, here in Texas and in so many other places in this country, women have been stripped of our rights over our own bodies. And I know that that's kind of a played out talking point at this point, but I can't emphasize, at least to like, It's weird. It's a weird feeling to have your rights just taken from you overnight, right? To know that if I go to the doctor, I have less rights today than I did a few months ago. And it's weird knowing that I can be feeling something and I need health care for it, and I may or may not be able to get it just because of my own body and because of the system. And in Texas, I know I focus on Texas because obviously I live here, but this is the case across the country in a lot of places. But maternal mortality rates are so high, they're not doing a whole lot about it. And the stat that you just read about Black and brown women, it's a real thing that a lot of us are very, very aware of, right? And there's a lot of societal and economic factors as to why those rates are so much higher. Racism within the system is probably just one of those things, right? And a lot of these reasons are very systemic, and you'd have to kind of go and explore all of them to really get to the bottom of it. But the point is, they're not getting to the bottom of these things because they don't care to. They're not doing anything to help these women. I know in Texas, our governor, he was asked about cases of rape in terms of abortion, whether or not those women should be able to have abortions if they were raped. And his response was basically, oh, we'll work really hard to eliminate rape in Texas, which is a non-answer. So they're giving answers that they know are nonsensical. Kids will never have to follow through on it because they're so ridiculous. And so they're kind of giving themselves permission to not have to do anything. And people are saying, okay, well, he gave an answer. So I don't know if they're satisfied with that, but they shouldn't be.
He said words, that's all it takes, I guess.
He said words, yeah.